Hello, my name is Mateja Zidarič and I'm a medical doctor in University Medical Center Maribor, Slovenia, in Department of Dermatology. Today I will present to you a clinical case report of a severe clinical manifestation of Darier disease. Darier disease, also known as keratosis follicularis, is a rare autosomal dominant inheritance disease with reportedly approximately 40% sporadic cases. There is an equal incidence of the disease in men and women. Manifestations usually begin at childhood and persist through adulthood. It is characterized by loss of intercellular adhesion and disordered keratinization with macroscopic picture of greasy papules and plaques in the seborrheic areas. Pruritic plaques may ulcerate, get crusted, or coalesce in larger lesions, which can become very painful. Body folds area are frequently a particular problem because the plaques are there often hypertrophic and the smell is very unpleasant. In some cases, papules do not always occur in hair follicles, but often aggregate to form verrucous lesions with keratotic crusts. Nail involvement is characteristic. There may be white or red longitudinal bands from lunula to the free margin, V-shaped notch, and subungual hyperkeratotic debris. Itching is one of the most frequent complaints, occurring in about 80% cases. Hemorrhagic maculas are less frequent. The prevalence in oral problems ranges from 10 to 50% and are often asymptomatic with no required treatment. Darier disease may be accompanied by some non-dermal symptoms like psychiatric symptoms, for example, mental retardation, epilepsy, or bipolar disease. There are currently no validated treatments available, so the main treatment is controlling the symptoms. Our clinical case report is about a male Caucasian patient with no family history of such disease. He developed the Darier disease as an infant with mild clinical manifestation that becomes severe in adolescent time. He lives with generalized form of Darier disease for more than 50 years now. The patient presented with generalized form of Darier disease with livid disseminated hyperkeratotic papules that ranged from flesh-colored to brown. The papules also coalesced to form large plaques. Rugates were scattered throughout the whole body. Fingernails and toenails were brittle and weak, and his face resembled facies leoninae. The patient was physically and emotionally exhausted, and his quality of life was significantly impaired. For diagnostic tests, we took biopsy from the skin, and histopathology results showed abnormal keratinization, so-called dyskeratosis, loss of intercellular connection, acantholysis, and abnormal keratinocytes. With direct immunofluorescence, the primary blistering disease was excluded. Over the years, the patient was frequently hospitalized for various secondary skin infections, also with sepsis, then with rugidiform inflammations, skin cracks, and in forefront was painful hypertrophic vegetation in skin fold areas. He also developed some subcutaneous nodules and abscesses. So over the years, we tried a lot of different treatment therapies, with oral retinoids, then with calcineurin inhibitors, systemic antibiotics, and systemic corticosteroids. Topically, we tried with tretinoin, corticosteroids, antibiotics, antifungal agents, with emollients, and also with antiseptic solutions. Moreover, we tried with phototherapy for proliferative lesions, electrocoagulation, and also surgical dissection. He was also administered pain medication in the acute phases of the disease. So for some time, clinical picture improved, however, the lesions always relapsed. Stress, heat, sweating, sunlight exposure, mechanical irritation worsened all of the above symptoms. Darier disease usually persists for life and is characterized by relapsing, remitting course. So the goal was to present a severe form of Darier disease, a generalized type, and our clinical observation. The disease is challenging to control and treat and can result in frequent hospitalization due to complications, for example, recurrent skin infections. Quality of life is adversely impacted by malodor and psychosocial consequence of appearance. Understanding pathogenesis of Darier disease has advanced greatly in recent years, but there are still many questions to be answered. Thank you and have a nice day.